Alrighty, now let's talk about something that could literally save your life. I'm talking about a colorectal cancer screening. March is Colorectal Cancer Awareness Month, and this morning, Erie County Health Commissioner Dr. Gale Burstein is back with Dr. Peter Bloom from Western New York Gastroenterology Associates to talk about this morning. Hello, welcome back.
Good morning.
And welcome, Dr. Bloom. Nice to have you here.
Thank you.
You know, this is the kind of thing nobody wants to talk about, and because they don't, this has made colorectal cancer the second leading cancer killer in the United States. So we have to start talking about this, and we have to start getting our tests.
Right. I mean, the scary thing is, Linda, is that this is really a silent disease. I mean, most of the time, people don't have symptoms for a very long time until after the disease has really progressed. So many times, the only way you're going to know that you have colorectal cancer is by getting a test. And so it's really important that people who are at risk get a screening test and depending on the test would depend on the frequency of the test.
And we're hoping while this segment is on, you'll see there's a web address, erie.gov. At that web address, you're going to find out whether you're insured or not, where to go ahead and get free screenings. But doctor, when people come into you, usually age 50 and over, men and women, correct?
That's true. We typically start screening at the age of 50, but there are certain higher risk groups. And for those groups, often we'll start screening at a younger age. For example, African Americans, we often start screening at the age of 45. Mm-hmm. So people with a family history of colon cancer or polyps, and there are some familial diseases that also carry a higher risk. So, and those are things that we carefully screen for before we will go ahead and to determine what screening test is most appropriate.
So going to your regular family physician, that family physician will see your age and see what your risk factors are, and then send them over to you for this test. And how often should they be screened for this? Well,
again, it depends on risk factors, but typically we'll start at the age of 50 for most individuals with average risk. And depending on the findings from the colonoscopy, and again, we feel that the colonoscopy is the best test for screening for colon cancer. There are a number of other tests, but that's the one that's preferred. Depending on what we find at the colonoscopy, that will determine the follow-up interval. So if we find polyps, typically we'll bring people back sooner. It may be 3 years, it may be 5 years. If we an absolutely normal exam, we'll bring them back at 10 years.
Dr. Burstein was saying, unfortunately, this is a silent killer because a lot of times you're not being bothered by symptoms, but what symptoms might present that might give you a heads up that this might be a problem for you?
Well, then I think it's very important to note that many people who come in, again, it is asymptomatic. However, there are some alarm symptoms that people should look out for. So seeing blood in the stool definitely can be a sign of something wrong. Again, there could be lots of causes of blood in the stool, so it's important not to jump to the conclusion that you have colon cancer. However, blood in the stool, loss of appetite, weight loss, abdominal pain, these are all things that could be subtle indications that somebody might have a more serious problem.
And I know that when some people go and they're told that they have a polyp, usually you go ahead and you take that polyp out and then you check it, because sometimes that can be, you know, an indicator that there's colon cancer.
Exactly, and that's the whole reason that we do this test, because we do a colonoscopy is to detect polyps and to detect colon cancer at an early stage. And that's, again, the extreme importance of this is that this disease is entirely preventable.
It's amazing. Okay, if somebody comes in and you tell them, look, there's a polyp, then they go ahead and they have their screening, they find out that it was positive, then what happens? Well,
typically we'll remove the polyp during the procedure. We send that off to the pathologist and he'll review it. And depending on the type of polyp, the size, the location, all of that will determine the follow-up screening interval.
Let me ask you this. For people who are just nervous about having this test, and we always talk about, look, after age 50, we all go in and get a colorectal cancer test. The prep is probably the toughest part, you know, to go in and make sure that you're ready for that procedure. The procedure is a snap because you're kind of asleep right through the whole thing. So it's easy as can be.
That's true. You know, for the vast majority of patients, this is not a difficult procedure.
No.
I mean, everybody is different. Everybody has different twists and turns in their colon.
Yeah.
But for the vast majority of patients, really the prep can be difficult, but there are a lot of newer preps.
Oh, yeah.
And they are more palatable. And I think the important thing to say about the preps is that recently we've had some improvements that have improved the quality of the preparation, which allow us to see the colon better. And that's also extremely important in terms of quality screening for colon cancer.
Let's also talk about some of the lifestyle factors which may make this disease present.
Sure. There are risk factors for colon cancer, and unfortunately we have some of those risk factors in Western New York. So high-fat diets, obesity, smoking, again, other risk factors, family history, are all contributing in terms of risk, and it can increase the risk of colon cancer and make it that much more important for colon cancer screening.
I just want to make sure the audience understands, when we're talking about colon cancer, colon, that's the intestine or the large bowel. So how can something like smoking or even a fatty diet increase your chance of colon cancer?
Well, those things can increase risk of all sorts of cancers, not just colon cancer. So there are studies that have shown that eating a healthy diet, eating more fruits and vegetables can be somewhat protective against colon cancer. Unfortunately, the data is not all there in terms of what is protective. Some people have suggested that certain things like aspirin can be protective, but again, we typically don't recommend aspirin for everybody because there are some other risks that go along with aspirin ingestion, like causing ulcers.
You know, it's so scary when we say this is the second leading cancer killer in America, entirely preventable if we go ahead and get our screenings like we're supposed to. So let me ask you this, what happens when someone comes in and it's detected? If you can get it and get it early, like you say, it's curable.
Right. Again, polyps over time can turn into colon cancer. So that's the first step, is trying to remove polyps and preventing colon cancer in that way. There are some people where we'll detect colon cancer where it's already there, and it really depends on the stage. Fortunately, if we're able to detect it at an early stage, most of those patients will do very well. With later stages, where patients have more advanced disease, treatment can be more difficult.
If we have people who are watching today and they're saying, oh, I remember my mom had polyps or my father, heredity can be a bit of a red flag too.
Hereditary factors are very important. So a risk of a family history of polyps, family history of colon cancer in first-degree relatives, and if there's several second-degree relatives that are also affected, that also is a red flag in terms of the increased importance of the need for screening.
And if that is the case, your doctor may send you before the age of 50 to go in and get that screening.
Absolutely.
Yeah, that will become part of your life, and that's that. But again, the important thing is that this is entirely preventable. It can be very, very treatable. Doctor does this all the time. And what we want to make sure you understand is that since March is Colorectal Cancer Awareness Month, this web address that you're seeing right here at the bottom of our screen can get you a screening. It'll tell you where they are around Western New York, whether you are insured or not insured. And there's lots of different ways to get screened, but you'll learn it through www.erie.gov. And as we always say, the life you save may be your own. It's important to take ownership of our health, get out there, see the doctor, get these tests, because you know what? There's nothing like having your doctor tell you you're absolutely fine. And that's what happens when you go out there and get your screening. Thank you, Dr. Burstein. Thank you, Dr. Bloom.
Thank you.
You're welcome.
All right, everybody, please write this address down, and we'll be right back.